Hello there, my lovely livers. I hope I find you all feeling healthy today. If not, I have a little test for you to see if maybe you might be experiencing symptoms of hepatic encephalopathy. It's called the hand flap test. My hepatologist does it to me every single time I go visit him in the office, and my radiologist taught it to me after she did my tip surgery. So she told me to do this every day to check to make sure that I'm doing okay on my HE symptoms. So, hand flap test, here we go. So you're gonna put your hands out like you're stopping a bus. So like, stop in the name of HE. All right, so stop. And as you can see, my my hand here, pretty good amount resistance, you know, it's not going anywhere, and I'm feeling good right now. If I was maybe experiencing some symptoms of HE, what you would see is if you pushed my hand back like that, there'd be very little resistance. You can see that. And what would happen is when my hand would go forward, it's gonna start to flap like that. And it can actually be both hands. It could be one hand, one or the other. But yeah, you're gonna see the little resistance when pushing it back, and it's just gonna kind of flop, and it's gonna do its little flutter thing. That's what we're looking for. If we're seeing that, then that means we need to take some action ASAP. You need to get some lactulose in you right away. You need to get yourself to the bathroom, and you need to have a bowel movement as soon as you can, because that is the fastest way to get the ammonia out of your body and to clear these symptoms out. Now, if you're in like the first stage of hepatic encephalopathy, you may see hand flapping, you may not. I have a little handy list here of what the stages are. So the first stage, the symptoms are going to be you're kind of confused, maybe you're kind of, you know, fumbling over your words, things like that. That's kind of normal with us for cirrhosis. It's low grade, grade 1 hepatic encephalopathy. Stage 2 is where you're going to start seeing the flap, is where you're getting drowsy a lot during the day, and you're starting to have some inappropriate behavior. A lot of times we'll get aggressive. You see some definite personality changes, and you're just like, that's not my husband. Like, my husband just asked me for a divorce, and we've been happily married for 40 years. Like, those kinds of things. Think of hepatic encephalopathy first. So then the next stage that you're still going to see the flaps at, and these are all definite stages that we need to take action on. If you're going to stage 2, 3, or 4, I want you to call 911 or go straight to the ER, okay? So the next one is when you're kind of in a stupor, you're making zero sense, you're doing behavior that is absolutely uncharacteristic of you. One thing I've heard a lot of spouses say is they'll find the cirrhosis patient like standing in the kitchen peeing their pants, you know, like they thought that they were in the bathroom. That actually happens quite often. So definite signs to get to the ER and get lactulose in your body ASAP. So yeah, and then the next step is coma. So it's very serious, it happens very fast. So if you have any hand flapping, take action immediately. It's a very serious situation, potentially life-threatening within hours. So please take this seriously. If you have the flap, call your doctor. Take action now. Always get lactulose as much as you can in you. It is your friend. It may not feel like it a lot of the times, but it actually is doing your body a lot of good. So please stay on top of your lactulose to prevent this from happening. But if you're ever wondering, do your hand flap test. Stop in the name of HE, and hopefully we will stop your HE from forming. All right, I hope everyone is doing well today. Hope you this helps. Comment, like, subscribe, share, please, so people have this information when they need it. All right, love you all. Take care. Talk to you soon.